Thanks, Kendra. Hi, everyone. Welcome to part one of prevention and mitigation of common infectious illnesses in childcare centers and schools. My name is Victoria Simpson. I'm an epidemiologist with the DISH team for New Jersey Department of Health. So in part one of this presentation series, we'll be covering common illnesses that we believe your childcare center or school may encounter in the next few months. We're not providing an extensive overview of all illnesses in this presentation series, though we do hope that we're able to cover the ones you're most likely to encounter. In part two, we'll continue our discussion by covering additional illnesses that are common on the school and childcare exclusion list. Some of the illnesses in this presentation series do happen more often in some months of the year than others, so we will try to note that seasonality as we go through today's presentation. The DISH team does have a webpage that hosts resources to help childcare centers and schools with infectious diseases. Following today's training, there will be an evaluation where you can let us know what resources you would like for us to create to help keep your childcare center and school safe from infectious diseases. We do create our materials based on your feedback, so we look forward to hearing from you. Additionally, you will be provided the slide set that we are using today. Several of the slides link to the resources we are covering today. We're going to place the link to the DISH team webpage in the chat now for you to access. Our email address is located on this webpage in case you have additional comments following today's presentation. Additionally, the school health page is always a good resource for infectious disease concerns. Here is where you will find many of the guidance documents that we are referencing today. Please note that even though the diseases we are covering today might be considered seasonal illnesses, they can occur in other seasons as well. If you ever have questions or concerns about an illness that is occurring within your childcare center or school, your local health department is always there to support you and to provide you with guidance. If you don't know who your local health department is, then us on the DISH team, we're happy to get you in touch with them. So all you have to do is email us at cds.rep.communications@doh.nj.gov, and we will help you find your local health department. Or when you get the slide set, you can always click on the link that says Local Health Department Directory, and it'll take you to a list of all the local health departments with their contact information. So we must first mention that COVID-19 is, of course, an infectious disease concern in every season. But for simplification, we do have separate resources where we discuss how to manage COVID-19 in childcare centers and schools. It's always important to consider COVID-19 as a possibility when you do have symptomatic individuals in your building. This presentation today, though, is for when the situations you're dealing with have illnesses that are not COVID-19. So for the remainder of this presentation, we will not be focusing on COVID-19. On your screen now, you can see the New Jersey Department of Health School and Childcare Exclusion List. Please note this exclusion list was just recently updated in June of 2022. We'll be mentioning some of the changes as we go through today's presentation. This is a resource that lists some illnesses that we commonly see in schools and childcare centers. Each row has the common symptoms associated with the illness, along with the exclusion timeframes that should be used when individuals present with these illnesses. This list only includes illnesses that are infectious. An infectious disease is a disease that is spread from one person to another and is caused by a virus, bacteria, parasite, or fungus. This exclusion list has a lot of valuable information that you can use if these illnesses appear in your childcare center or school. The last column of the exclusion list lets you know when the disease is reportable to your local health department. For example, you will want to call your local health department for some diseases when you only have one case occurring in your building. For others, you will only report the disease to your local health department when you see multiple cases of the same disease in the same time frame and setting. For several of the illnesses on this list, they are only reportable if an outbreak is suspected to be occurring or is occurring. It's important to know that even if an illness is not reportable, if only one case occurs in your building, you should always call your local health department if multiple cases of the same illness appear in one group during the same time frame. So many of you are probably familiar with this reporting magnet that lists diseases that are immediately reportable to the local health department or reportable within 24 hours of discovery. These diseases should be reported to your local health department by the person who has supervisory power at the child care center or school, such as the child care center director, a principal, or a school nurse. It's always a good idea to have this list printed out in case you encounter these diseases in your child care center or school. However, some of the most common diseases in child care centers and schools are actually not going to be listed on this quick reference sheet because you only have to report most of those diseases if an outbreak is suspected to be occurring. However, it's still important to know which diseases are required to be immediately reported. So if you need a copy of this quick reference magnet, when you get this slide set, you're just going to click on the word reporting and it'll take you to the online version. It is important to note that New Jersey regulations are under revision, so some of the information on this reporting magnet is likely to be updated in the future. The current link can always be accessed on New Jersey Department of Health's website. So before we move forward, I first just want to know how many of you know how to contact your local health department. So I think we have a poll question popping up now. Do you know how to contact your local health department? Just tell me yes or no. I'll give you a few minutes. All righty, great. It looks like most of you already have a relationship with your local health department. So for those of you who answered no, that's okay. Just when you get this slide set, reference the beginning of the slides. You can find the DISH team's email address. You can email us and we can help you get in touch with them. Or you can go to that link to the local health department directory and you can find their information that way. So these illnesses from the exclusion list that you see on your screen now may occur in your child care center or school soon. For instance, acute respiratory illness and influenza are common in the fall and in the winter. Hand, foot, and mouth disease most often occurs in the summer and early fall. Norovirus can occur at any time of the year, but is more likely to occur from November to April. And strep throat and fifth disease are common in the winter and in the spring. If you find these illnesses on the exclusion list, you will notice that they are only reportable if there is an outbreak. So it is important to keep in mind to continuously monitor for outbreaks and notify the local health department immediately if you think an outbreak is suspected. So if you think you do have an outbreak, this guidance document may be very helpful to you. So this is a resource called the General Guidelines for Control of Outbreaks in School and Child Care Centers. It spells out when an outbreak may be occurring on page 1. For common diseases such as acute respiratory illness, hand, foot, and mouth disease, influenza, strep, and fifth disease, an outbreak may be occurring if several children are exhibiting similar symptoms and are in the same classroom or wing of a facility or attended a common event. Additionally, if there is an increase in school absences with many parents reporting the same or similar symptoms as the reason students are not attending, an outbreak could be occurring. If you think you may have an outbreak in your child care center or school, the first step is always to notify your local health department. And then the local health department will work with you to go through the next steps, including how to control the outbreak. So at the bottom of that General Guidelines for the Control of Outbreaks, there is a letter that can be utilized to send to families when an outbreak is suspected. It's always best practice to let families know when there is an infectious disease concern in your child care center or school. When you do think you need to send a letter or notification of any kind to families regarding an infectious disease concern, reach out to your local health department for help with preparing these notifications. They can make sure you're providing accurate information about the infectious disease to your communities. Additionally, in this same General Guidelines for Control of Outbreaks document, control measures are listed. When you're dealing with a suspected outbreak, the local health department may suggest that you implement various measures to minimize infectious disease transmission. These control measures might include things like additional cleaning and disinfecting protocols, food handling techniques, etc. It really just depends on that initial information that the local health department gathers from you when you make that first report of the suspect outbreak. So for more information on how to handle a general outbreak, you can watch this video titled General Infectious Disease Outbreak Training, which can be found on the DISH webpage. Again, when you get this slide set, you just have to click on this link and it'll take you directly to it. Sometimes when you have an outbreak, you may not know what disease you're dealing with when the outbreak first begins, but this video is not going to be disease specific, so it is helpful whenever you see an increase in illness, even if you don't know the diagnosis. So to begin our review today, it's important to understand how diseases are spread. Diseases can be spread by different ways or modes of transmission. Direct contact occurs through skin-to-skin contact, kissing, and sexual intercourse. Droplet spread is also considered to be direct contact. This is when droplets are spread by coughing, sneezing, or even talking. Indirect transmission is when an infectious agent is transferred to another person by suspended air particles, inanimate objects, or vectors, which are living organisms that transmit diseases, such as ticks or mosquitoes. Some diseases that we will discuss today can be spread by both direct and indirect contact. So it's important to understand how to implement prevention measures to minimize transmission. This presentation is to provide you with information that is helpful in case your school or childcare center encounters the illnesses that you see on your screen right now. We're now going to go through each illness in detail. But before we do that, we do just want to know, have you saw any of these illnesses in your childcare center or school already? So there's another poll question popping up, I think. So if you can just check the ones that you may have already encountered in your childcare center or school for us, I'll give you a few minutes to do that. Okay, it looks like you all have seen acute respiratory illness and influenza the most, followed by hand, foot, and mouth disease, GI illness and norovirus, strep throat, and fifth disease. Okay, that's great for us to know. Thank you guys so much for participating in that. So we are going to start with discussing acute respiratory illness and influenza. So acute respiratory illness and influenza have two different rows on the exclusion list, because though it's likely that individuals with respiratory symptoms might have the flu, there are other illnesses they can have as well. So acute respiratory illness is a broad illness classification that encompasses several respiratory diseases, such as RSV and the common cold. However, for the purposes of preventing additional respiratory diseases in your childcare center and school, both rows of the exclusion list, acute respiratory illness and influenza, have the exact same exclusion timeframes, the same reporting requirements, and basically the same prevention measures. So the only difference you're going to find when you look at those two rows on the exclusion list is that the symptom list is just a little different between acute respiratory illness and influenza. So individuals with acute respiratory illness may often have a fever and a runny nose, along with nasal congestion, sore throat, and/or cough. Of course, this row should only be used on the exclusion list in the absence of another known cause. Individuals with the flu may often have a sudden onset of fever, headache, chills, myalgia, otherwise known as muscle aches, sore throat, nasal congestion, cough, mild pink eye, fatigue, and abdominal pain. So the exclusion criteria for acute respiratory illness and the flu is actually the same. The child should be excluded until fever-free for 24 hours without fever-reducing medicine. Now remember, COVID-19 does have a different exclusion timeframe, so it is important to rule out COVID-19 before utilizing the exclusion criteria for acute respiratory illness or the flu. Additionally, children should never be present at the childcare center or school if they have a fever. So fever actually does have its own row on the exclusion list because you may not know what illness is causing the fever at the time that it presents. So remember on the previous slides, we talked about that general outbreak guidelines document that you could use if you don't know what the diagnosis is for the outbreak. Well, this slide actually has a document on it that's specifically tailored to respiratory outbreaks. It goes over important steps to take if the outbreak is respiratory in nature. And the next slide will go over some of the prevention measures in this guidance document called Respiratory Outbreak Information for Schools. So acute respiratory illness and influenza are spread through contact with respiratory secretions. The prevention steps for acute respiratory illness and influenza are basically the same. So New Jersey Department of Health recommends that schools and childcare settings increase education on respiratory hygiene. In order to stop the spread of respiratory illness, children and staff should be taught to cover their coughs and sneezes with a tissue or sleeve instead of their hands. They should avoid touching their eyes, nose, and mouth with unwashed hands, and they should wash their hands frequently, especially after coughing or sneezing. They should also stay at home if they're sick. Additional prevention measures that can be implemented in childcares and schools to prevent infectious disease include things like routine and cleaning and disinfecting of frequently touched surfaces and objects that may be easily contaminated, as well as maintaining an adequate supply of tissues, soap, paper towels, alcohol-based hand rubs, and disposable wipes. And of course, adhering to exclusion recommendations from public health. So remember, for the flu and acute respiratory illness, sick individuals have to be excluded until they have been fever-free for 24 hours without fever-reducing medication. Of course, hand washing is important to prevent these diseases, along with any communicable disease. So this website has hand washing posters that you can print out. When you have the slide set, you can just click on this slide and it'll take you to those posters. And now I'm actually going to pass it over to Stacy, who's going to go over some more details about acute respiratory illness.
Thanks, Victoria. Hi, everybody. I'm Stacy DeFrank. I'm a nursing consultant with the DISH team. And we just wanted to take some time to point out some examples of diseases that are considered acute respiratory illness. If RSV is specifically identified, this slide may be beneficial. RSV is a respiratory virus, and it's spread from droplets from talking, coughing, or sneezing, or by touching contaminated objects. RSV doesn't have its own section on the exclusion list, so you can still follow the exclusion times listed under acute respiratory illness. And it's important to report outbreaks of RSV when they are suspected. Individuals presenting with common colds can also use the acute respiratory section of the exclusion list, and many different respiratory viruses can cause the common cold, but rhinoviruses are the most common. Other viruses that can cause colds include RSV, human parainfluenza virus, adenovirus, and common human coronaviruses. So this one-pager lists the types of coronaviruses that cause mild to moderate respiratory tract illness, like the common cold. And yes, COVID-19 is a coronavirus, but not all coronaviruses are COVID-19. They are not interchangeable. These common coronaviruses are transmitted through coughing and sneezing, personal contact, such as touching or shaking hands, or touching contaminated surfaces. So if you're notified of coronavirus that's not COVID-19, you can utilize that same exclusion criteria that's mentioned under respiratory illness on the exclusion list. So to summarize all of that, many diseases can be classified as acute respiratory illness, so like RSV or common cold, and this section of the exclusion list can be utilized for those purposes. The most important thing to remember is to notify your local health department if you think you have an outbreak, and they will help you from there. So we also wanted to show you some flu-specific resources, which we'll do now. And if you have an individual diagnosed with the flu in your child care center or school, we have some other resources that we can also provide for you. So this first one is a web page, and it has a comprehensive list of flu resources that you can utilize. When you get your copy of the presentation, just click on that word influenza, and it can access the web page for you. And this one pager can be utilized just to remind you about flu prevention. So getting the flu vaccine every year is also very important for flu prevention. The flu vaccine prevents millions of illnesses and flu-related doctor's visits each year. It helps to save medical resources for those suffering from other diseases, and also helps protect you and those around you. Everyone 6 months of age and older should get the annual flu vaccine. And remember, even healthy kids can get seriously ill from the flu and can also easily spread it to others. So children who are 6 to 59 months of age who are attending a licensed childcare or preschool in New Jersey are required to have the flu vaccine by December 31st of each year. This link will take you to the CDC's flu guide for parents. When there's a flu outbreak, this is a great tool to educate your families. This document goes in detail about how to protect children from the flu, information on flu vaccine, and what to do if children get very sick from the flu. And when there are confirmed flu cases, these self-care tips are helpful for families as well. So next, we're going to talk about hand, foot, and mouth disease. Hand, foot, and mouth disease is most prevalent in the summer and early fall, so now. Symptoms of hand, foot, and mouth disease include fever, sore throat, malaise, which is a way to describe fatigue or general weakness, ulcers in the mouth, and blisters on the hands and feet. When you find hand, foot, and mouth disease on the exclusion list, you'll see that individuals should be excluded until they're fever-free and no longer drooling due to mouth sores. If you have hand, foot, and mouth disease cases, this one-pager is an exposure notice that can be utilized to inform parents of the disease. During an outbreak, it's important that families are notified so they can monitor for symptoms more closely and prevent spread. And this FAQ document is on New Jersey Department of Health's website, and it's about hand, foot, and mouth disease. And it is spread from an infected person to others through close personal contact, such as kissing or sharing utensils. It can also be spread through the air when an infected person coughs or sneezes. Contact with feces or contact with contaminated objects also can spread the virus. Some people, especially adults who get infected with the virus that causes hand, foot, and mouth disease, may not have any symptoms, but they may still be contagious. So this is why people should always try to wash their hands, cover coughs and sneezes, so they can help prevent the spread of those germs. If someone is exposed to hand, foot, and mouth disease, symptoms usually develop within 3 to 5 days. So this one-pager also outlines ways to prevent or control hand, foot, and mouth disease, and they're the same techniques we mentioned with respiratory illness. So it would be hand washing, cleaning and disinfecting items that are touched often, educating children on how to cover their mouths and noses when they cough and sneeze, and avoiding close contact, such as kissing and hugging and sharing eating utensils. And just in case you want to know more about hand, foot, and mouth disease, we have a short video on our DISH webpage, and you can click that link when you receive your copy of the presentation, and it'll take you to our page. So next we have another poll. Which of the following are symptoms of hand, foot, and mouth disease? And we want you to choose all that apply. So fever, pink eye, blisters on the hands and feet, all the above, or none of the above. All right, good job, guys. So fever and blisters on the hands and feet were the two answers. And we're going to move on to Sarah, who will talk about GI illness.
Thank you, Stacy. Hello, everyone. My name is Sarah Bradzinski, and I'm also a nursing consultant on the DISH team. And next, we will be discussing GI illness and norovirus. Both tend to be most common in the winter and the spring. And on this slide, we see that GI illness and norovirus are listed separately on the exclusion list. It is important to keep in mind that local health departments typically assume the disease is norovirus as opposed to another GI illness, as that is the most likely cause of the illness. It is also the most contagious. The only time the GI illness row will be used is if the local health departments know for sure that norovirus has been ruled out by laboratory stool testing. Individuals who have GI illness or norovirus may experience nausea and or vomiting, diarrhea, abdominal cramps, fever, chills, body aches, and headaches. As you can see, this slide lists the exclusion criteria for a GI illness when norovirus is not suspected, which again is a very rare occurrence. When a child is experiencing diarrhea, the child should be excluded until stools are contained in the diaper, or toilet-trained children are no longer having accidents and stool frequency becomes less than 2 stools above normal frequency for that child. When vomiting occurs, children should be excluded if there have been more than 2 episodes of vomiting in 24 hours, and vomiting is not from a known non-infectious illness or condition. Please note that this guidance has been updated as of June 2022 and is one of the important changes to note on the new exclusion list. Lastly, staff should be excluded from cooking, preparing, and touching food until 24 hours after symptoms of vomiting and diarrhea have resolved. When norovirus is suspected, the exclusion criteria is a little more conservative as norovirus is very contagious. Unless norovirus has been ruled out by laboratory testing, children and staff who are experiencing symptoms of norovirus should stay home from school or daycare until 24 to 48 hours after symptoms have resolved. Staff involved in food preparation should be restricted from preparing food for 48 to 72 hours after symptoms have resolved. The staff may perform other duties not associated with food preparation 24 hours after resolution of symptoms. The outbreak definition for norovirus is also a little more refined than it is for the previous diseases that we have discussed today. Remember, for general outbreaks, which would include GI illness that is not suspected to be norovirus, an outbreak may be occurring if several children are exhibiting similar symptoms and have attended a common event or are in the same classroom or wing of a facility. Additionally, if there is an increase in school absences, with many parents reporting the same or similar symptoms as the reason for which students are not attending school, an outbreak could be occurring. However, if a norovirus outbreak is suspected, the outbreak would be defined as 2 or more students in a classroom or group of students with onset of vomiting and or diarrhea on the same day, or a doubling in the normal number of students absent due to vomiting and or diarrhea over that particular time. For example, if 3 students were per week is the average number of absences you see in October, and it increases to 6, and they all have the same GI symptoms, this would be a reason to call the local health department for a suspected norovirus outbreak. There is a document made specifically by the New Jersey Department of Health that explains how to handle norovirus outbreaks. When you receive a copy of this slide set, the title of this slide will take you to that document. Next up is a poll question to test your knowledge. If everyone could take a moment and answer. What is the best way to prevent the spread of norovirus? Alcohol-based hand sanitizer, soap and water, baby wipes, or all of the above? All right, and great. We have 70% are soap and water. Wonderful. All right. Thank you so much for taking the time to answer that for me. And we'll go into that a little bit further in this next slide. It is important to note that all of the prevention methods listed on the slide are specific to norovirus. However, they would also be beneficial in eliminating other GI illnesses as well. Norovirus and other GI illnesses are spread through eating or drinking contaminated foods, putting your fingers in your mouth after touching contaminated surfaces, and direct contact with someone who is infected, such as caring for them, changing diapers, or sharing foods or utensils. It is important to always use soap and water to clean your hands after diapering or toileting, before eating, and before medicating. Do not use alcohol-based hand sanitizer as it does not work on norovirus. Additionally, you will need to clean surfaces with an EPA-approved disinfectant such as a bleach water solution, to effectively kill norovirus. The cleaner should sit on the surface for at least 10 minutes or until dry. Norovirus can live on surfaces for up to 12 days, so using the proper cleaning products is critical to kill the virus. Laundry that comes in contact with vomit or feces should be washed separately and as soon as possible. During an outbreak or suspected outbreak, communal and self-service food in classrooms should be restricted. Instead, staff should wash his or her hands and then hand out food items directly to each child. Please visit the norovirus outbreak document linked to this page for additional detailed information. The CDC also has this great infographic that goes over how to prevent norovirus outbreaks from food contamination. 1, stay home when sick. 2, avoid touching food with bare hands. 3, wash your hands. 4, rinse fruits and vegetables. 5, clean and sanitize surfaces and utensils. And 6, cook shellfish thoroughly. In this slide, we see an image of the stomach bug book. This book is another great resource to walk you through how to prevent the spread of norovirus. These tips would also prevent the spread of other GI-related illnesses. Of course, local health departments will follow the outbreak, so if other specific prevention methods are needed, they will be sure to review those with you in more detail. And before we move on, we have another poll question for you. Staff can return to work after having norovirus symptoms, blank hours, but should be restricted from preparing food for blank hours. So 1 would be 48 and 72, 2 would be 24 and 48 to 72, 12 and 72, or 0 and 0. All right, great, wonderful. Yes, and the answer is 2, 24, and then 48 to 72 hours after. Wonderful. Now we're going to now we will discuss strep. Strep throat is the only disease that we will discuss today that is a bacterial illness and not a viral illness. Because strep throat is a bacterial infection, antibiotics are necessary to treat it. Strep symptoms can include a fever, sore throat, enlarged lymph nodes, a sandpaper-like rash, swollen and inflamed tonsils and or throat, sometimes with white patches and or streaks of pus, and a hoarse voice. Individuals who have strep throat should be excluded from the childcare center or school until at least 12 hours after antibiotic treatment has started and the child is feeling well enough to participate in activities. Please note that this is another recent change to the exclusion list. The exclusion time has been changed from 24 hours to 12 hours after the child has received their first dose of antibiotics. Another symptom of strep is fatigue or tiredness. A student should not return to school if they are unable to participate in regular activities, as it is very important to get enough rest while they are recovering. Strep throat is spread a few different ways. When an infected individual talks, coughs, or sneezes, for example, respiratory droplets containing strep bacteria are released into the air. A person can become infected by breathing in those respiratory droplets, by touching something with droplets on it and then touching the nose and or mouth, and drinking from the same glass or eating from the same plate as someone infected with strep. Rarely, people can spread strep through food that is not handled properly. The prevention measures for strep throat are listed on CDC's website and include covering your cough or sneeze, throwing tissues in a wastebasket, washing hands with soap and water for at least 20 seconds, and using alcohol-based hand sanitizer when soap and water are not available. Be sure to wash glasses, utensils, and plates after a sick person uses them to prevent the spread of strep. And the last disease we are going to discuss today is fifth disease. This disease usually presents as cold symptoms followed by a rash. The most notable symptom is the slapped face appearance on the cheeks. It is good to note that there is no exclusion requirement for fifth disease, as it is usually mild for both children and adults. However, if a person has a compromised immune system from a chronic disease, also known as being immunocompromised, fifth disease can cause more serious health complications that may require medical treatment. On this slide, we see an example of an exposure notice that can be sent to families when fifth disease cases are identified. Fifth disease has no specific treatment and will go away by itself. Exposure notices are helpful to make families more aware of early symptoms of the disease, as well as practices that they can use at home to help prevent the spread of the illness. This FAQ document from the New Jersey Department of Health states fifth disease is more common in children than adults. A person will usually get sick within 4 to 14 days, but sometimes even up to 20 days after getting infected with the virus. About 20% of children and adults who get infected with the virus will not have any symptoms. Fifth disease spreads when an infected person coughs or sneezes. You are most contagious when it seems like you have just a cold and before you get a rash, joint pain, and/or swelling. After you get the rash, you are probably not contagious. Once again, you can reduce your chance of being infected with the virus and infecting others by washing your hands often with soap and water, covering your mouth and nose when you cough or sneeze, not touching your eyes, nose, or mouth, avoiding close contact with people who are sick, and staying home when you are sick. And for our last poll question, what is the classic symptom of fifth disease? Fever, slapped face appearance, back pain, or blisters on the hands and feet? Give you guys a moment to answer that. Great, wonderful. 93%, we have a slapped face appearance is a classic symptom of fifth disease. Thank you so much. And that is all the illnesses that we will be reviewing today. Please join us on February 21st for part 2, when we will discuss other common illnesses on the exclusion list. Please keep a lookout for additional registration information from Rutgers. Lastly, when you receive this slide set, you can utilize this resource slide to access all the links and documents that we have used in this presentation.